The mosquito-borne Zika virus has been around for years in Africa and Southeast Asia, and in that time it barely registered as a problem. That was until it turned up in Brazil. In just 9 months, there have been 500,000 cases of contagion with the virus and a suspected link to a dramatic rise in birth defects in babies.
Normally, Zika is not a very dangerous disease. It's very self-limiting with mild symptoms. But what we see in Brazil right now is that in lots of the areas where we have Zika infections, women also have born babies with microcephaly.
Microcephaly is a condition in which a baby's brain and head don't fully develop. Back in 2014, before the virus arrived in Brazil, there were 150 known cases in the country. Since October, that's jumped to 4,000. The link to the Zika virus still hasn't been confirmed, but it's enough to prompt senior US health officials to act as if there is one.
We are quite concerned about the potential complications to the fetus of Zika virus infection of pregnant women. And so we really are advising that pregnant women seriously consider postponing travel to these areas if possible.
Those areas cover 20 different countries throughout Latin America and the Caribbean, and there have already been a handful of cases in the United States. Health officials are still not clear why it's flared into an epidemic so quickly, but they're worried the Olympic Games in Rio de Janeiro next August could provide the conditions for it to spread even further.
It's
the Olympic Games, and a lot of tourists from all over the world will arrive in Rio de Janeiro, and they will be exposed to the risk of getting a virus. So Zika has consequences not just for the Brazilian public's health, but for the public health worldwide.
As yet, there's no vaccine or treatment for the Zika virus. Officials in Brazil, Colombia and El Salvador have taken the unprecedented step of advising women not to get pregnant at all, for now. Zika is spread by the same mosquitoes that carry dengue fever and other diseases. They thrive and breed in small amounts of still water. Health officials say avoiding or limiting exposure to the mosquito is the only answer, making mosquito eradication programs like these all the more important. Miriam Nahond, Al Jazeera.